Okay, so I've just proven that the sympathetic nervous system goes all over the body and it affects arteries, capillaries, and veins. All right, so let's look a little bit at this system in motion. Nervous system is fast, right? It's why we evolved it. The humoral systems are much slower. A chemical has to be released, it has to be moved around in the blood. It can take minutes. Well, nervous systems are fast. Seconds is all it will take for the nervous system to respond to a thing. So let's look at the case where we've had a sudden change in blood pressure. Okay, so let's say you have been lying down, having a very good night's sleep with a great dream, and you get up in the morning because you realize you're a little late for class, you stand up really fast, and your blood pressure drops, right? We've all experienced this, orthostatic hypotension. Why? Well, when you stood up, suddenly the blood circulating in your body was pulled to the planet, right? So it all ended up in your feet. That caused your venous return to decrease, which caused your cardiac output to decrease, which caused your blood pressure to decrease. Okay? So all those things, you have a decreased blood pressure. What does the body do? Well, the nervous system responds. Remember, it has receptors. Baroreceptors very rapidly detect this decrease in blood pressure. The sympathetic nervous system responds by increasing cardiac and vessel stimulation. All right, so heart beats faster and stronger, vessels constrict, both of which will elevate your total peripheral resistance. Okay, veins are going to constrict, pushing some of their circulating volume into the arterial system, and the heart will beat stronger and faster. All of those things work to increase blood pressure, right? Heart rate, because increasing cardiac output, increased total peripheral resistance directly increases blood pressure, more on that later. And then we've increased our effective circulating volume by venoconstriction. All of this happens within 5 seconds. Like, it's very fast. So this is the system by which the body adapts to rapid changes in blood pressure for whatever reason. This happens all day long. It happens in the reverse too. If you've been standing all day and you lie down, your blood pressure changes. It actually goes up, right? Because now instead of fighting the planet, you're not anymore. So your cardiac output and pressure tend to go up. Then this whole system does the reverse game, right? Where it turns all the stimulations down. Okay, so if we look at the mechanisms here, we have baroreceptors and we have chemoreceptors. Okay, remember that baroreceptors are detecting pressure directly. Chemoreceptors are detecting CO2, oxygen, and pH, which you can kind of think of as the results of blood flow, right? So the chemoreceptors are making sure blood is flowing well enough. The baroreceptors are making sure that the pressure is high enough. All right, so where are these detectors? Okay, first one, carotid body, is in the carotid sinus. It's right where the internal and external carotids divide. They have a special set of nerves called Herring's nerves, which carry that information up into the brain through the glossopharyngeal nerve of all things. So that's kind of a weird idiosyncrasy. We also have baroreceptors in the wall of the aortic arch. Okay, so we have two places that directly detect blood pressure. All right, so what we see up here is examples of those baroreceptors in action. Okay, so here we're sitting at a blood pressure of 100, and we clamp closed both carotids. Don't do this in a patient. Okay, bad idea. All right, but we're trying to make a point here, right? So we clamp closed both carotids. Well, so down here we've clamped it closed. The carotids are going to immediately see a rapid reduction in pressure, right? Because you put a tourniquet in front of it. The response is going to be to reduce the number of firing, to reduce its firing rate. That's the signal that pressure is reduced. The sympathetic nervous system's response to this perceived decrease in pressure is going to be a big stimulation. We're going to increase vasoconstriction, and we're going to increase heart rate and contractility. Both of those things are going to tend to push pressure up. So when we clamp the carotids, the body responds with an increase in blood pressure overall. That's an example of the carotid sinus doing its job. It detected a decrease in blood pressure, and it increased blood pressure appropriately. Now, when we release the clamp from the carotids, all right, now suddenly they see a much higher blood flow, so then they immediately reduce their stimulation, right? So that graph is proof that when pressure changes, the sympathetic nervous system responds. When pressure decreases, it responds with an increase, and vice versa, okay? What this is showing you, this is arterial blood pressure. This is number of pulses per second from the carotid sinus nerves. So it's showing you that there's kind of a correlation. The higher the blood pressure, the faster it ticks, right? So it makes it a meter, right? A fast ticking sinus is high pressure. A low ticking sinus is, or a low tick rate is a low pressure. So it's showing you how the meter works, essentially, right? That as the more ticks the body sees, the higher the pressure it is being sent. So these sensors feed into the brainstem, and then within seconds, the brainstem sends a response back out through the autonomic nervous system to respond, right? So, yes, sir.
Sorry, on that previous graph,
Yeah.
Top left, how does the body know
Here?
to decrease pressure before the carotids are released? Like right immediately before the carotids, the drop?
Or the release should be here.
Oh.
It's poorly labeled.
Okay.
Because you're right. How would it know to drop? It couldn't. The stimulus for this decrease is the carotids being released. They're not used to PA students looking at the pictures. Just kidding. Right. Yeah, it should be technically be right there because that's the stimulus. Be careful about pictures in the textbooks and pictures you find online, because here's a little known fact: the people who make the pictures are not people who know what the pictures are of. Right? Because it's done by artists. So you will find errors in diagrams, okay? So just be careful, ask. If something doesn't look right, ask. Because the people making the diagrams a lot of times don't know the material. Surprise, right? The other thing that's weird is I have found in my 15 years of teaching, you're more likely to find an error in a textbook in a picture than you are in the text itself. I think it's edited less, like the photos and the diagrams are edited less. So just to let you know, like this one, this should really be over here to be more clear. But all right, so we have this cardiovascular system, or this autonomic nervous system. It's monitoring our blood pressure through the sinuses all the time. What benefit does that give us? Okay, so top graph versus bottom graph. Top graph, okay, here's pressure, here's time. This is blood pressure, okay, so over many days, multiple 24-hour periods. When we have an intact autonomic nervous system, our blood pressure tends to stay stable around a relatively narrow range. Now, it's not a straight line, okay? Our blood pressure varies constantly. You all know that, right? But day after day after day, it never gets below this, and it never gets above this. It stays in that nice line. Now, if we take away the sympathetic nervous system by taking away the baroreceptors, in other words, we denervate the receptor input, then we see the bottom graph, where blood pressure is all over the map, right? Now, why is it so variable? This is a dog, by the way. I'm not a fan of that, but that's what we're looking at. So they took a dog and they took away its sympathetic nervous system. Moment of silence for the dog, right? For real. It's sad, but the point still is, okay, so narrow range all over the place. as we go through our days, okay, our fluid, like how much fluid we drink changes. Our activity level changes. What we eat changes. So our ion concentrations change. Got a lot of things changing. Without the sympathetic nervous system, all those little changes in our behavior would result in changes in blood pressure. Okay, so what we're seeing here is this is the value of a sympathetic nervous system. It keeps our blood pressure in a relatively narrow range, regardless of what we do, what we drink, what we eat, all those things. Okay? So we avoid wide variations across days, which no, that would not be good for the patient. Okay, so this is referred to as our pressure buffer system. And that is a bit of a loose phrase because it isn't really a buffer like in chemistry, but it works the same way. Remember that a buffer keeps pH in a relatively narrow range, right? Well, here, our sympathetic nervous system keeps our blood pressure within a relatively normal range. Despite the fact that we go from lying to standing or standing to lying, or we increase our abdominal pressure, all of these things, activities, would have a tendency to increase or decrease our blood pressure if it wasn't for this system. Now, interestingly, the baroreceptors are just a meter. They are not the place where blood pressure is set for the body. Okay? They're just the speedometer, so to speak. And the reason I say that is we know that the body will defend a blood pressure around a normal range, but that range can change. Okay, so you have a lot of people walking around with high blood pressure. Does that mean their baroreceptors are broken? No, their baroreceptors work fine. The issue is the hypothalamus has set the blood pressure too high, right? So the baroreceptors are maintaining the pressure that was set by the hypothalamus, but the hypothalamus got the pressure too high, right? Now, there are a number of things that we have learned to do to affect that, but in the end, that's essential hypertension, is the patient's brain has set their blood pressure too high. That's the initial problem. How do we fix that? Interestingly enough, we do not go and fix the brain because we do not know enough about how that system works. Someday, maybe there'll be a medicine that actually affects the vasomotor center and lowers blood pressure, but that isn't what we do today. The vasomotor center works just fine. It actually becomes our enemy in fighting hypertension because it's trying to bring the pressure up all the time, and we're trying to keep it down. So we're fighting the autonomic nervous system all the time. So studies are ongoing about the role that baroreceptors play or could play in setting the long-term blood pressure.